LWALA.
Kisii LWALA.
Tusonge mbele.
Tusonge mbele.
Bas, God bless you.
Thank you.
Litukoria rero intumune department ya amangana yobogwenia ase county ya Kisii ntoro no mogoko monene sana twanyarire korikirana nse ne NGO enene koregasi ime ya South Nyanza asa mangana yo korigereria oroiboro ntoma yetenga abantu baita abange abangina baita abange banyare bako chandika sana kera bare bebwatraneti lakini agreement ito saini rero ntonyare kwenana abangina bonsi ase county yaito ebifaa biri biko bakonya mbanyara guitera manyinga amange kera bakonyora abana oyo naro tokoroka magenderero kiagera amangana yonse takaba possible ta konyarekana onye ntweka abagusi ase county yetu ya Kisii ntogo chamo tonyare kubwa komokonya omugabano ito Paul Simbarati obwate mepange miya yogo chenchia amangana yobogwenia ase county yetu ya Kisii mosike Paul Simbarati ngotarari nyagitari chionsi pina nachaka gotare wiki yaeta kurigereria maendeleo nyare okora ase county ya Kisii na tarara nyagitari kirichikwagachwa gocheke osento bwata mario gaisaina nyagitari cheito na andere nagenda gotoimiza muna ntwa bakore gasibe county department ya health tonyare kobeko mukia erio tonyare gokonya kuhakikisha munga mariogo abekura nyagitari cheito kya Kisii eri abantu baito ba Kisii banyara konyara mariogo ayo anyare ko bakonya okeya abantu waire bakonyara singa cyabo igo rero ogo saini gutwa sainiri okuigwana no gutwa nyare gutwa ne rishirikeri lya LWALA ndinyare go chenchia chinchera tokomane chamangana ito yokurwaria ase county yetu ya Kisii igontoro no mogoko monene ngago chakarero egende getoko saini ya rero ne chibesa chinyinge chieta ne chimilioni 10 chibese chi echigo chikogenda gokonya abantu baitu ba Kisii igo twakero mugabano itombia muno kiaranya tariere chimilioni jitwanyorire ntwaye konyaga gochinyora aina tokoro kama enderero iga abantu baminto ba Kisii tobege ntekemo Paul Simbarati nabwate mepange miya yogokonya abantu baye lishirikeri nyitariere ntware korinyora tusaine memorandum of understanding igona nje tabantu baye obwanchani obwatworokirie na intu muna bakore baitega baye gasi tunyakorokia abantu baito bwanchani tubakorere gasi no moyo yomo tonyare gochenji Kisii ito tonyemesie mbiya mono chindugu chiane kuruga iga South Nyanza bwana Julius na bwana Ogendo abana abantu abaya nyasaba seseni nyasayo wedi ero kamano. Thank you so much.
Good morning. My name is Julius Mbea. I'm the co-CEO of LWALA Community Alliance, and we are very privileged to be here in Kisii this morning to sign a memorandum of understanding with the county government of Kisii to improve health outcomes with a focus on maternal and child health outcomes, and particularly addressing obstetric hemorrhage, which is the leading killer of women in our country, in our county, and many parts of Africa. This collaboration between LWALA and Kisii County government will ensure that we are adding to the protocols for management of PPH, including the use of non-pneumatic anti-shock garment as part of PPH management, training healthcare workers on emergency obstetric and newborn care, and improving mentorship processes. Our partnership, I think, will ensure that all the health facilities across Kisii County that are providing deliveries have the non-pneumatic anti-shock garment, and that all the healthcare workers in Kisii are trained and mentored on EMOC. This is a beginning of a long-term partnership that we envisage with Kisii County, and we hope that this collaboration will improve health outcomes for the over 1.5 million people in this county. Thank you very much.
Nyakweba, the CC for Medical Services, Public Health and Sanitation, Kisii County Government. Today, we are privileged as a county to put pen to paper an MOU, a memorandum of understanding between Kisii County Government and the LWALA community, whose main focus will be a reduction of maternal and maternal mortality rates that we are experiencing, not only in Kisii, across the country. So we are so grateful for the leadership of the Kisii County Government, His Excellency the Governor Paul Simbarati, who has made it possible for us to sit here today to have this MOU signed. We know his main focus and the focus of his government is the improvement of our health care systems and services across the 161 facilities owned by the Kisii County Government, plus the 150 facilities that are either faith-based or privately owned. As we sign this MOU, our officers working across those facilities in the county have been instructed to ensure that we start the implementation process immediately so that our people can start reaping the benefits of this MOU. We know LWALA community has very good programs for our county. And we want to reiterate our commitment as the county government of Kisii that we should put more resources towards the purchase of the NASG products, which will go a long way in reduction of the maternal deaths that we experience in our county. And we begin from now, going forward, and we are looking forward to working with the other partners who are currently based in Kisii. I know Jacaranda Health is also handling the same program. So this is another advantage that our county government is going to get. And therefore, our assurance is we shall be committed to the spirit and letter of this MOU. So we look forward to ensuring that our people in Kisii, we want to urge you and inform you that the Department of Health is ready and willing to change the narrative that is outside there, that our services are not meeting your expectations. So the signing of this MOU is therefore towards addressing that expectation that you have, which was our promise as we formed this government. So thank you so much, LWALA community. Thank you so much, our health workers who are present here today. And together, I know we have the ability and the capacity to transform the lives of our people, because we know a health nation is a wealth nation.